Peace be to you all. Assalamualaikum. Happy Friday to you guys. So I wanted to first introduce myself for those of you guys that don't know me. Omar Abdul-Malik, Doctor of Health Education, Physician Associate, moderately fit, middle-aged athlete, and family man. So I wanted to talk to you guys about the board exams for the PANRE, that is the Physician Assistant National Recertification Exam. So if you've been a PA for a number of years like me, this will be, I'm approaching my 25th year of being a physician assistant, now called a physician associate. So we have to take our boards every 10 years. It was every 6 years. So that's every 10 years. So if I pass this exam, I will not have to take it again until the year 2034. By that time, I will be in my my mid-60s. So hopefully, maybe I'll be retired. Who knows? Allahu Alam. But anyway, I can't tell you about the specifics of the exam because I had to sign an agreement form for that. But I can tell you, I can give you guys some advice for those of you all who are new graduates preparing for your PANCE. That's the Physician Assistant or Physician Associate National Certification Exam. So go to the NCCPA website. That's the National Coalition for the Certification of Physician Assistants. Something like that. I forgot what acronym. There's so many acronyms and abbreviations in the PA realm. So if you go there, NCCPA, that will give you the blueprint for the PANCE and the PANRE, depending on which one you are preparing for. And it will tell you almost everything that you need to know on there. And you can also pay for practice exams that has a lot of similar information on there. So it will get you kind of into test taking mode, if you will. One of the things, I'm glad I did that because there's a lot of case studies on there on the exam. Now I can't tell you specific questions because it's forbidden, but be familiar with reading case studies and trying to diagnose illnesses or the best treatment plan, or knowing the first line drug, medication of choice, or the treatment of choice for various illnesses. And there's nothing way out in left field. You're not going to get asked the same level of questions that are on the USMLEs, the United States Medical Licensure Exam for those in medical school. They're not going to ask you anything coming from step 1 or step 2. We used to study from those many years ago because there weren't a lot of PA testing books out there. But anyway, just know things on the level of a physician assistant. I'm just going to say physician assistant. So that's what I've been calling myself for years. And most of the questions deal with things like diabetes, hypertension, and so forth. Again, there's some very good testing books out there. I usually use, there's just one in particular I used. I talked about it in one of my videos. But go, certainly use your blueprint. And then use your experience. If you are a newly minted PA or you're in your last year of PA school, use your experience on your rotations, OBGYN, your internal medicine, pediatrics, emergency medicine, surgery, and your end of rotation exams. Understand how to answer questions, and then if you're an experienced PA, you may have to go back and review things. Salter-Harris fractions or fractures, APGAR for newborns. Denver developmental milestones for the pediatrics patients and your vaccine protocols. And what else? Try to get good rest the night before. and try to be there early. Try to be to the exam testing center early. You know, they ask that you show up half an hour early. It takes time to read through their, you got to read through their rules and regulations, and then you've got to sign in, bring 2 forms of ID. It'll tell you the rules on the NCCPA website when you register for the exam. And dress in layers, because the room in which I was taking the exam, it was, I'm a hot weather kind of guy, obviously. It's about 80 degrees now. But it got really cold in there for me, and my hands were cold. But thank God I dressed in layers. I even had like undergarments on, like long johns, because I was really cold. And I saw some folks in shorts and t-shirts as flip-flops. I am not wired like that. Maybe it's my African heritage. I like warm weather. But I'm glad that I dressed in layers. I wish I had worn gloves, because even my hands were cold. But oh, and they don't allow hats unless it's religious wear. They're very, very strict. They took a venous reading of my vein patterns in my hand. I hadn't seen that before. I was like, wow. Then I had to pull out my pockets, turn around, you know, take off my glasses, and let the brother who was the exam proctor. So why did I have to examine my glasses? Then I thought, oh, Google glasses. Imagine taking an exam and you can Google, you know, the answers to whatever, you know, or you know, some kind of information that'll help you pass the exam. So as our technology has increased and the sophistication of cheaters has increased, you know, they got to be more stringent. The exam proctors and the exam administrators have got to be more stringent about checking people before they actually take their exam. So keep that in mind. Try to pace yourself. I didn't do that so well on some questions. I took too long reading through the case studies and rereading them. Did second and third guessing myself. Bad habit of mine. So you get about 1 minute for each question. So it can be very vexing. And I would suggest, speaking from vast years of experience, don't go back and change your answer unless you absolutely know that it's correct. Okay, that's it for now. I wish you guys the best of success in your positive endeavors. If you wish to be a PA like me, it's a great career. It's a 2-year master's program after your undergraduate degree. And most of us major in biology and chemistry and stuff. And, you know, we're making between 120 to 150 on average. Good morning. So it can be very challenging, but very rewarding as well. All right, that's all for now, guys. Take care. Peace.